everyone. Welcome to our second webinar this month for CalMap. Our topics this month has been all about ADHD, and for our session today, we'll be talking about the principal skills of parenting management training. My name is Eileen Ho-Hui Wayne. I'm one of the child psychiatrists staffing the CalMap consult line. I also help organize CME activities along with our CME team leader, Dr. Joanne John. A few announcements before we get started. We have a new name and a new website, but we're still the same group and offering the same service. We're now called CalMap, and we still offer real-time consultation that includes clinical personalized guidance on how to apply what's taught in our webinars and ECHO to your own patient's care. And you can see the instructions and sign up website that you can use to request consultation via phone or online. You can also call us at 800-253-2103 or request a consult on our new website. We now also offer monthly webinar series recording, which is called the on-demand webinar. You can view these recordings on your own time and then just answer questions afterwards to get CME credits. And these credits will be also, besides CME credits, there's also MLC Part 2 credits for each webinar you complete in this way. Another few housekeeping items. Today's session will be recorded and it will be posted on our website after this talk for your viewing. If you have any questions during the talk for Dr. Zalecki, our expert today, during or after the talk, please use the Q&A feature in the webinar and we'll try to save 10 minutes at the end of today's webinar to answer your questions live. If you have any questions for our speakers, please type them in the Q&A section and don't use the chat function. Thank you for doing that. For interest of time, I'm going to go ahead and introduce our speaker today. It's our pleasure to have Dr. Zalecki. Dr. Christine Zalecki is a clinical professor in the Department of Psychiatry and Behavioral Sciences at UCSF, where she's the clinical director in the HELP Clinic. She also is an attending psychologist in the Schwab Dyslexia and Cognitive Diversity Center. Dr. Zalecki is a licensed clinical psychologist who specializes in diagnostic assessments of ADHD and learning disorders and psychosocial treatment of children and adolescents with ADHD and behavioral disorders. Dr. Zalecki received her BA in psychology from UC Berkeley and her PhD in clinical science from UC Berkeley. She subsequently completed her predoctoral internship and postdoctoral fellowship in the UCSF Department of Psychiatry. She has been the director of 2 NIMH-funded studies of ADHD, the follow-up studies of girls with ADHD at UC Berkeley, and the Child Life and Attention Skills Program at UC Berkeley and UCSF. She is also a clinician on the NIMH-funded MTA study at the UC Berkeley site. With this, please take it away, Dr. Zalecki.
Sorry. Now I'm not muted. So today I'll be talking about ADHD and parent training, which is one of the evidence-based treatments for ADHD. And we do a lot of parent training in my clinic in the Department of Psychiatry and Behavioral Sciences at UCSF, but I'll also be providing some resources for other ways that families can access PMT. So I'm hoping today to talk about parent-child interaction patterns that can be really problematic for lots of families, but especially those with ADHD, and cover something called the ABC model, which is what we use to both analyze and change behavior, talk to how to talk to families about developing a behavior plan, and then also talk about something called the extinction burst that is helpful to know about, because when we tell parents, oh, just ignore behaviors that are problematic, well, we know they're going to get worse before they get better. So it's good to have families know to expect that. And then also I want to make sure that I'm also covering how, of course, you can cover some of these strategies in a brief session or shorter session with a family. When we're working with families on PMT, it's typically at least an 8-week protocol. Sometimes, as many as 10 or more sessions. So of course, you're not going to be able to do that in a primary care setting, but how can you take bits and pieces of what I'm going to be describing about PMT and use those with your family as well. So we'll go to the next slide. So just first, uncovering what our kind of primary symptoms of ADHD are. Of course, we have this cluster of inattention symptoms. We have a cluster of hyperactivity and impulsivity symptoms. Kids need to be having some of these symptoms at least before age 12, about 6 of 9 in one cluster or the other or both, need to be impairing across settings and be exceeding what's developmentally typical. We have the 3 subtypes of ADHD, that's predominantly hyperactivity impulsivity subtype, which would mean at least 6 symptoms of hyperactivity impulsivity, but the absence of at least 6 of inattention. Typically, the hyperactivity impulsivity, predominantly hyperactive impulsive subtype, is limited to preschoolers once they're in school and have to really sit down and focus and pay attention. Then we see more inattention symptoms, but still, that is one of our subtypes. We also have the predominantly inattentive subtype. This is where we have at least six, perhaps more symptoms of inattention, but the lack of predominance of hyperactivity and impulsivity. These are the kids that are the hardest to diagnose, the hardest to identify. They're often identified much later. These are the kids who are assessing and diagnosing oftentimes in middle school, high school, or even beyond. So, and then of course there's a combined subtype, both hyperactivity, impulsivity, and inattention. And I mentioned that these are primary symptoms because there are a whole host of impairments that are really common in families that I think we also want to listen for when we're talking to families to see both, do they meet criteria for ADHD, but also what can be most helpful for them as far as intervention. So the next slide, please. So not all families, but in many families, they are facing, when they have a child with ADHD, they're facing lots of challenges at home. Also, of course, at school for these kids, but I'm going to focus, because we're talking about PMT, what we might be wanting to target for families at home. So homework, of course, you all can guess that, for kids who have a hard time paying attention and focusing, doing homework is a huge challenge. They've just spent all day in school doing something that is very hard for them, which is pay attention and sit still. And now here we are at home. Everyone's tired, parents are tired, kids are tired, and now they have to do even more work. So for lots of reasons, homework can be a big challenge. A lot of times kids don't even know what their homework is. They don't have their books. So there are just many organizational reasons too why this is such a challenge for them. And we know that kids with ADHD often, even though it's not part of the diagnostic criteria, emotion dysregulation is very, very common. So they get very frustrated with homework very quickly, and then things can get explosive really fast. Routines, especially doing routines independently, is very hard. So morning routine in particular, I always tell kind of fellows and trainees I'm working with, if you're wanting to assess ADHD, ask about what it's like getting out of the house in the morning, because this is often very, very challenging. Kids needing constant prompting just to do the basic things they do every day. Parents will say, you think they would know by now what to do every morning, but even if they know, they simply cannot execute on that. So getting ready in the morning is really hard. Just lots of just not following through on basic things, real messy, that kind of spacey, lost their focus, even during mealtime can be very difficult because they're so spaced out, not paying attention, and just taking a long time to do something basic like eating, lots of conflict, and lots of negotiation. So that's something we'll be sure to cover, negotiating about whether or not they get more screen time or get to stay up a little bit later, whatever it is. So, and then for kids with combined type or lots of hyperactivity and impulsivity, just sitting through meals can be very, very challenging. So for a lot of these families, they've given up to even trying to go out to restaurants and things. So, next slide. So a lot of, sometimes we hear kind of parents and teachers say, oh, that the problem here is they're just lazy, or they're not motivated. And we know these kids, for most of them, right, they're actually trying very hard. They're really wanting to please. I often say to parents, they're probably trying twice as hard as the kids sitting next to them, but it's very hard to execute on the things they need to do in the classroom. So on the one hand, I say, no, they are motivated. They're not lazy. On the other hand, we do know that the motivation system for kids with ADHD, just individuals with ADHD, are just different. So for example, getting doing a homework assignment or taking a test, and knowing that in a few days you might get that positive feedback is just not enough. So any kind of delayed reward, that is not enough to motivate them. So what's motivating for typical students are just not motivating for kids with ADHD. That threshold is just different. And any kind of delayed reinforcement doesn't work as well. And they're often just not, that idea of kind of avoiding punishment is not as potent for kids with ADHD. So a lot of what we're doing in PMT and working with parents on is how to really boost that motivation system. I'm often saying to families, what's in it for them to do things any differently than they're doing it now? And that's where PMT comes in, to really use motivation and kind of try to bolster that system to at least get some systems, some behaviors kind of more internalized, so that then they might not need that boost, but at least to get started, we want to really boost that system. So then they're able to execute on these things they know they need to do. The other piece of this is it's very hard for us, just in general, not just kids with ADHD, to be motivated to do things we're not good at. So think about things in your life you're not very good at. If someone said you have to do this all day, every day, which is essentially what school is, it'd be very hard to motivate to do that. So also, it's I think, helpful to keep that in mind, that we're trying to expect kids to be motivated to do things they're not good at. It's a big ask. So that's also where PMT can be very helpful in using rewards very systematically, as I'll talk about in a moment. So we'll go to the next slide now. So I'll be focusing on PMT, but I just wanted to give everyone a broad strokes view of what other treatments are available. Of course, medication, there is part of PMT. We're often doing a lot of classroom consultation. There are summer treatment programs for kids with ADHD. There's one in the East Bay, but these tend to be more, the STPs are more likely to be taking place on the East Coast. Family therapy, systemic family therapy can be very helpful for kids more with ODD and conduct disorder. And then there are other parenting protocols, PCIT, very helpful from very young children, triple P, incredible years. So these are also available, very, very similar to what I'll be covering today. So the model that we use is PMT or behavioral parent training. Notice what's missing from this list is child therapy. So that's important because when we do get some, a handful of referrals each month for, we just want them to have therapy. We know that just working through these problems with kids or talking about being more organized, even trying to build skills, it's just not, it doesn't work nearly as effectively as doing parent training, because we know that we can introduce these skills to kids, but then as far as them actually practicing those skills, that's where the parenting piece comes in. So individual therapy for kids can absolutely be helpful for things like anxiety, depression, other areas, but to actually reduce those primary symptoms or even secondary symptoms of ADHD, we're really wanting to work with the family, work with the parents and teachers, but not individual therapy per se. Okay, next slide. So sometimes there's a question of, well, we know that for many of these kids, our medications are incredibly helpful. I mean, it's first-line treatment in general, so why would we still need medication? So we know that not all kids are med responders or aren't able to tolerate medication, so that's one reason. Some parents really, as some of you may have experienced, just they are not, that is a hard no. They are not going to medicate their children, especially for ADHD. And quite frankly, medications, they can certainly help with these symptoms, but we know too that once they stop taking the medication or even just don't take it for a brief period of time, they are going to, they're not learning any new skills. So we're going to see the behaviors appear again. So we also know that these medications, they wear off by the end of the school day. So by the time the kids are home and trying to do their homework, that medication is often worn off. And in the morning, as they're getting ready for school, as I said, morning routine can be a huge challenge. They're not on their medication yet. So for parents, even for kids that are on medication and they're really good med responders, the teachers benefit, but the parents are still really struggling with these behaviors. And medications are great for reducing those primary symptoms of ADHD that I listed, the inattention, lack of focus, hyperactivity. But as far as really then targeting those secondary features like parent-child conflict or poor academic habits or social skills, that's also where PMT can be very, very helpful. So we know that even once those primary symptoms are reduced, some of these other things still remain, and that's where PMT can be very, very important. So what we're doing when we're working with families is some of it, quite frankly, is just psychoeducation and kind of normalizing their experiences. Like, yes, this is what kids with ADHD do. They have a very hard time. Even just getting out of the car seems to take forever. That can be helpful, just hearing about the basics of ADHD. But we're really kind of coaching parents and how to kind of change the environment, kind of coach their kids on how, or coaching the parents on how to coach their children to be more organized, to be more systematic about how they approach things. And we want to really work with families, as I'll talk about in a moment, on both the antecedent side of their behavior and the consequence side, and be really strategic about how they're working with their child instead of just taking this, make it up as you go along type approach that, of course, we all default to. So one of the core features is we're really, for kids who are dysregulated internally, the behavior system, the attention system, the emotion system are all often quite dysregulated. We want to regulate the external environment as much as possible. So that's also what we're really trying to help families with. So this is, as I said, it's an evidence-based treatment, both for ADHD, for ODD, and also for function disorder. And one of the things we start with, and that can be real helpful for parents to kind of see in the first place these interaction patterns that are developed, is we're really targeting these patterns that have just naturally built up over time that we want to start to disentangle for families. So let's take a look at that on the next slide. So I often use this example for parents because, as I said, it's so common that morning routine is very drawn out and lots of chaos. So, and parents, the way I describe this, when parents say that they often default to things like nagging and yelling and threatening, that, well, guess what? It's because that works in the moment, because these patterns have developed. So the example I often give when I'm doing either my groups or working individually with families is, okay, so say it's time to get ready in the morning. What do you say? You say, okay, it's time to get ready. What's your tone of voice like? It's probably just nice, normal. You're not yelling yet. You've just said it once. And then what happens? Nothing happens, right? The child isn't getting ready. They're either just dawdling, they're reading, they're playing, they're doing something else. So what does the parent do? They repeat it again. Time to get ready. Now they're maybe a little bit louder. Everything's just starting to escalate already a little bit, right? We're no longer just nice and friendly. We're starting to get a little louder. Child's still not getting ready. This can go on all morning, by the way. So what happens then? The parent's actually yelling out, hey, it's time to get ready. Come on, we got to get going. Still perhaps nothing happening. What do we go to next? Now we have threatening. If you're not ready, we're going to be late. You won't get to do that play date. There's threatening. Everything really escalates. For some kids, that's when they finally get ready. For some, maybe not. They're like, oh, we've heard this before, whatever. So I'll say to parents, well, how does this end? And this is why I like to use morning routine as an example, because it has to have an end. Homework kind of can drag out all night, but the morning routine, eventually you get out of the house. Well, how does that happen? Well, a lot of parents will say, well, finally I just give up and I dress them. That's the only way it happens. Well, I've seen parents of 7th, 8th graders that are still dressing their kids because they've gotten in this pattern. So that's not ideal. That's not sustainable. Or they're rushing at the last minute and everyone finally gets out, but or the kid finally gets going, but it's only after they've gone through all of these steps. But in general, everyone is frustrated. It's a really rotten way to start your day, this kind of chaos and yelling, but this is often what we see. And after I go through this example with families, I ask the following question. So we'll go to the next slide. So in this scenario, what has the parent learned? What have they learned works? Well, they often have learned, and again, the child, I say, has inadvertently taught the parent this. It's not like the child has purposely done this, right? But over time, kind of parents and kids kind of teach each other things that aren't so helpful. So what has the parent learned works? They've learned that nagging works. They've learned that yelling works, threatening. Some parents will say it's not until I threaten and yell that they actually do anything. So they learn that works. They've also learned to kind of focus on negative behaviors. They've learned that in the end, it's really easy to just do it for them, right? So kids aren't developing independent skills. They've learned that sometimes negotiating is what it takes. And once in a while, it's best to just give in and just, that's it. I'll just dress them. They give in to the demands, or they'll say, yes, fine, okay, watch TV or watch a show during breakfast, even though they really don't want to be doing that. But they're also ignoring good behavior. So that occasional time that the child does get ready somewhat independently, they might just move on with their morning, but not even notice that, oh, they're doing a lot better this morning. So that's what the parent has learned works over time. What has the child inadvertently learned? What has the parent kind of accidentally taught their child? That first of all, it's kind of okay to ignore instructions the first few times. They taught them that, if you really negotiate, sometimes it works. And that, I'll say it the first time, I'll say it the second time, I don't really mean it until I yell. And kids, negative attention is still attention. We know that, behaviors that are given attention to will be repeated, even if it's negative. And sometimes there's something in that back and forth that goes on between families that's very reinforcing to kids. And again, I'm not saying kids have literally purposely done this, but if I just pulled out, eventually my parent might do it for me. So this is not helpful. It gets them out of house in the morning. And again, in the moment, it works to, get everyone moving, but it's not sustainable over time. And that is how this is maintained over time. And we know that these kind of interaction patterns and these kind of parents defaulting to these strategies are pretty robust predictors of some negative outcomes for kids who have ADHD and behavior problems. So in PMT, this is what we're trying to really disentangle and work with parents on. And not just for morning routine, but in general. So what we're using is what we call the ABC model of behavior change. Oh, if you could go back, there we go. Yeah. So this is a really nice model because this is if we can get parents used to using this model, then it's not just going to work when they're 5 or 6 years old, or we're still focused on morning routine, but also throughout kind of development and adolescence on other types of problems. So in this model, we have A as antecedent, B as behavior, C as consequence. Behavior, there's not a lot parents can do about that, right? They cannot crawl into their child and make them put their shoes on right away or make them do their homework. We really want to focus with parents on specific observable behaviors when we're using this, not qualities or traits, right? But specific behaviors, not a lot they can do about that. But what about on the front end? What about the antecedents? So this is where parents have control. What happens before the behavior? How can they set their kids up to succeed? And I'll talk in a moment about a handful of antecedents. And then, by the way, antecedents can be right before the behavior, the way they give instructions, or it could be the night before and how they, getting enough sleep can be an antecedent to the morning going better, or not being hungry when you're trying to do your homework. So any kind of in time before the behavior. Consequence, what happens after the behavior? This could be specified consequences, either positive or negative, or natural consequences, right? Well, if you're not ready on time, I guess you'll be late, right? Okay, so you're late to practice. Well, the coach might be mad at you, or you might be getting detention or whatever. Well, that's a natural consequence. It can also just be attention, quite frankly, negative or positive attention. Attending to behavior that's both positive and negative counts as a consequence. The next slide kind of lays out a handful of these. So when we're working with families, I'm giving a snapshot here of these. I'm going to cover these pretty quickly. But in general, what we're focusing on with the antecedents are, first of all, really trying to help that parent-child relationship be as positive as possible. We're going to use effective instructions to set them up to succeed. We're going to have some routines. We're going to have structure. We're going to really set those expectations in a clear way and give a little reminder about what's in it for them to follow through, right? Remind them about their consequences, both positive and negative, and parents staying calm and well-regulated as they're trying to execute on these things. We know, of course, ADHD is highly heritable. Many of the parents we're working with have ADHD themselves. So the ability to stay calm, remember what those routines are, and execute on that is actually pretty challenging. And then consequences are things like positive consequences, praise, rewards, and also negative consequences. But of course, as I mentioned, natural consequences as well. And the next slide. So focusing on antecedents to start. Again, I'll go through this a bit quickly, but we really want to give a little bit of a check on how that parent-child relationship is, because if parents and kids, things have really gotten negative, we need to start there, right? Because it's very hard to, we're taking this top-down approach of changing the parenting behavior to then influence the child behavior. Well, if there's a lot of negativity, then it's much less likely that child is going to really follow through and buy into the program. So we encourage them to do lots of special time, attending time. I tell parents this is money in the bank for a few weeks from now when we're going to really start expecting some behavior change. If you haven't developed some kind of goodwill with your child, it's going to be much harder to do that. So there's something called attending time where, and some of you may have heard of this, also called special time. The parents just watching the child play, just commenting once in a while on what they're doing, but no judgment. And it's undivided attention, which is real important. And a lot of kids really get a lot out of this. So we start with special time or just increasing playtime together. A lot of parents say, oh yeah, I realized we haven't played in a long time. So it's a nice reset to just work on that relationship. So that's a big antecedent to start with. And then next slide. So another basic, and I call some of these things kind of soft skills, so is really work on effective instruction. So for kids without ADHD, it might not matter so much if you yell something across the house or you bury the instructions and lots of talking. For kids with ADHD, though, who have a hard time paying attention and tracking kind of verbal, discussion, it's that much more important. So ineffective instructions, and many parents are like, uh-oh, I do all of these. A lot of our parents do a lot of talking. They'll say, it's time to come in and do your homework. Don't you know how important it is? You haven't done any homework this week, and I don't know if you're going to get good grades, and da-da-da. They're talking. Somewhere in there is an instruction. It's time to come in and do your homework. But it is just buried in all of this talking and rationale. I tell parents a lot, keep in mind that ADHD, it's not a knowledge deficit. Your child knows what they're supposed to do. It's an execution deficit. So all of this talking and explaining and things you're doing, it really is distracting from that core instruction you're trying to give. So when you have a parent in your office who is talking and talking, some way of subtly saying, hey, let's just simplify. Let's keep it real simple. Give those instructions simply. Chain instructions, too many things at once. They're never going to remember all of those. Repeating over and over again. Question instructions. Hey, do you want to do your homework? Or, hey, how about you clean your room? It's kind of implying that there's an option. Vague instructions, right? Try hard, be good. What does that mean, right? We want to be really specific. But the big one for a lot of families is distant instructions, yelling it across the house. Even though the parents are yelling to their children, time to come to your homework or set the table, the kids still experience it as yelling. And chances are they're going to miss it, and then the parent eventually has to go to the room and give the instruction. I say just start there, because then you won't be so frustrated, and the child is much more likely to succeed. So we're really going to want them to use effective instructions. They're essentially the opposite. And staying calm, staying neutral, not yelling those instructions. This can make a big difference for lots of kids. Making sure you have their attention, then give the instruction, perhaps ask them to repeat back too. Then, if they don't follow through, especially if you have a behavior plan going, you at least know you've done your best to set them up to follow through on that. Okay, the next slide. So another big piece of PMT, and this is what can be very hard for our families because so many of our parents have ADHD, and they will say, I cannot organize myself. How can I organize my child? Or I don't have my own routines and structure. How can I possibly do this for my kid? Or especially in families, quite frankly, where there's not just one child, but 2 or 3 who all have ADHD. Parents have ADHD. So this can also be a helpful intervention just, for the parents. So structure, routines are very important antecedents. So it's really, I tell parents too, you're coaching kids when you put together a routine list for them and have them check it off. You're teaching them that skill that they may not, automatically develop. But hey, when you have a lot of things to do, it's really helpful to make a list, check things off, and then reward yourself. So this is also building independent skills because we want parents to say, hey, what's next on your list? Instead of time to brush your teeth, time to put on your shoes, time to do this. hey, go check your list. So you're teaching that more independent skills. So we really want parents to post this list, include the number of prompts. So that's important too. If they're giving a reward at the end of the morning for, if you get through your morning routine, you get this. Well, what if they took 5 prompts per step versus only 1 prompt per step? Well, I still got through it. We want to, those are very different mornings though, right? So we want to build into the system and set them up to succeed of such a plan like, get started, complete each one of these tasks with 2 reminders per step. And then give a very specific instruction. Here's your first reminder, time to put your shoes on, right? So we're really coaching them to follow through, but not expecting them to suddenly be able to do all of this independently if they've never been able to do it before. We'll have parents use timers, develop a song list, different, okay, you have to have your teeth brushed after this song, things like that, to really keep them on track, but be reasonable about those time limits. A lot of parents will say, well, they know what they need to do. It's as simple as like 3 things. They do it every day. Still, post the list. Have that visual checklist, which is really, really important. The format doesn't matter so much, but having the list somewhere is very helpful. Next slide. This is just an example of this was put this together for a family that the parents kept complaining that the child was never in bed on time. And when we really kind of did so-called do the math on their evening, well, the parents' organization for the evening was way off. So they were saying, well, they want him in bed by 8:30, but they were often not even starting dinner time until 8. So we really developed this routine for them. Oh, also that, he took, I think, like a melatonin gummy, and they were giving it right before bedtime instead of, an hour or so before. Anyway, the point is we put together this routine that, yes, it was for the child, but it was also really for the family, the parents, to remember, okay, yeah, we've got to get going with dinner by 7. And then we don't want him calling out at bedtime that he's still hungry. So we're going to make it really clear that kitchen's closed and then not negotiate about more food afterwards. So again, these checklists and things can be really helpful, not just for the child, but also for the parents to stay on track, because their routine and the child's routine is dependent on the parents. Next slide. So just another basic consequence, and this is something I think we can really model in our offices, working with our families, is just this very basic skill of catch your child being good and using lots of praise. So right when I have when a parent and child come to my office, oh, I really like the way you sat down. Oh, you're following directions so well. Oh, look at you. Yeah, you did. I only told you once and you did that. That's great. So you're really showing the parent how important this is. I kind of overdo it a lot to make the point, but still, we want to be very specific about our praise, use it often and strategically, praise effort, and also really watch for when parents are praising, but they have this negative tinge on the end of it, because we want to work with them on that, spoiling the praise with something like, wow, you did your homework. So that's so hard, like, kind of negative on the end there. Let's just stick with, wow, you did your homework. I'm so proud of you. That's great. Because yes, this is something that we see often in families. So trying to really keep praise specific, unspoiled. And I remind parents, praising, using specific praise. Oh, I like the way you did that. And I didn't even have to ask, is a way of telling your child, do this behavior more often, right? It's a way of prompting them without actually prompting them. It's a way of reminding them, but in a really positive way. Next slide. So now, you may have encountered some parents who say, well, we never use rewards. Those are bribes. I don't use rewards. I don't believe in that. And I, subtly or not so subtly, will suggest to parents that even if they don't think they are probably using rewards. If you've ever told your child, no, you can't play, first do your homework. Or sure, you can go do that, but first clean your room and then do that. You are using rewards, right? So what we're suggesting is just be more systematic about it and make sure that your rewards are potent. So this can be helpful if you have a parent who says, we've done a reward program, it doesn't work. You want to do a little check on that. Well, what rewards are you using? Are they really potent to the child? Do you have a sticker plan going, for example, for a child who doesn't really like stickers? Or are you giving rewards only on the weekend? And that's just too far away, for a 6-year-old. We need more immediate rewards. So the way parents are using rewards can sometimes be, we just need to tweak that a little bit. It can be much more helpful. So, we want the rewards to be potent and meaningful right away if possible. So morning routine, we want a morning routine reward. not an end of the day reward, or especially not a week reward. Now, we eventually will kind of broaden that out, but at least to start, to get some momentum, we're going to give that reward right away or right after homework, right? Do your homework, then you get your reward, instead of, oh, and then this weekend you'll get something. And still use praise, lots of follow through. Ideally, we want daily rewards and weekly rewards. And for parents to understand too, they're going to have to change up this system once in a while. What's rewarding one week, not so much a few weeks later. Screen time, of course, is an exception to that, screen time and phone. But for the most part, we've got to mix this up a little bit and not just expect we can put together a program and then just let it ride for the rest of the school year. So the next slide. So when we're putting together a behavior plan, we're really connecting those antecedents and consequences. And there's several ways to do this. One is a point system, which for some families, it can get a little complicated, but essentially the kids are earning points. They add up those points, and then they earn a daily reward and a weekly reward. For a lot of families, just a really basic when-then system is what's most practical. Once you get through your morning routine, then you can have, you can listen to whatever you want in the car. Or once you do your homework, then you can have your screen time. So it's a real straightforward, do this, then you get this, right? That's most practical for lots of families. This so-called marble jar program can be really good to target more low base rate behaviors, right? So, okay, so you have a marble jar and you have these number of marbles, and then each time you do a certain behavior, we're going to add some marbles to that. And once those marbles add up, then you get this. So that's nice for low base rate behaviors. You always want to assume, though, that there are going to need to be some prompts involved as well. Okay, next slide. So in general, we like to really have parents think about starting with a reasonable number of behaviors. We don't want spreadsheets, so maybe 5 or 6 things to start with. That's why morning routine is so helpful. Oh, and by the way, the other thing that's great about starting with morning routine, these are things that kids have to do anyway. You're not creating more for them to do. You got to get out of the house. Why wouldn't you want a reward? Is the way we can kind of frame it. We want to set them up to succeed. We want them earning those rewards and really connecting the dots on do this behavior, then you get this. Eventually, we'll internalize it. We don't have to keep giving rewards, but at least to start. We also don't want to set up an all or nothing system. Get your homework done, 100% every day, and then you get a reward. Like, no, we want something that's a little bit, we can still reward some effort there. And consistency, and this is what's so hard, is the consistency. But if you've said that they get a reward, they get that reward. And if you've said that they haven't earned it, they don't earn it, even with all the negotiating. Nope. So in fairness, to just be matter of fact about this, avoid kind of over-explaining and nagging and shaming. And the more the kids are involved in developing the program, the better. So we have, for example, a reward list or a reward survey we give to families. We want parents to also be really positive, that this is going to be helpful for all of us, that we're not putting this together for you because you're so bad at getting through your routine, but, oh, this will help me kind of yell less, and it'll help us just all get out of the house more easily, things like that. So next slide. So here's just an example. I know it's very tiny, but you'll be able to see it in the slide. So again, the way we would set up each one of the behaviors, and then there's a point system. And notice on this that we've also listed the rewards. We want to be very clear. Do this, then you get this. So that also can cut down on negotiation. So there's the point system. And then the next slide is what we call the when-then. Get through these things, then you can pick from this menu of options. And that can be very effective too. And again, in a lot of families, it's the most practical way to go. Next slide. And here's an example of a morning checklist. You can see that the number of reminders is very clear. I mentioned, specific instructions. Don't just take your pill. Take it within 1 minute. We're not going to drag this out for 10 minutes. And it's also very clear, if you're done by this time, and I've only given you 2 reminders, here's what your reward is. That's what we want, is a very clear, everything is laid out. So even if it's not in a fancy checklist system or it doesn't, the format doesn't matter. So this can even just be on a piece of paper with one of those, plastic sheets, and they mark it off each day with a, whiteboard marker, and then wipe it down and do it again the next day, and that's fine. So I'm going to move along a little more quickly because I know we only have about 5-10 minutes before we're going to do a few questions. So we always want to start with positive consequences, right? So this is important. If you hear a family saying, we have a behavior plan and they don't earn this and we're taking this away, encourage them to start with positive. we know that it is much more effective for kids to work toward a reward instead of avoiding a consequence. So, for example, if you hear a parent saying, or you know that the way they're framing this is, if you don't do your homework, you're not going to get screen time. Just switching it to, hey, once you do your homework, then you earn some screen time. It's the same outcome, but it's much more motivating to just phrase it. So this is something they're earning instead of being punished. But for some things, punishment can be helpful. We work a lot with parents on what we call strategic ignoring. This is just for attention-seeking behaviors like whining or repeatedly asking for something or negotiating. So this really works well if the parent has worked on that relationship. The features are, though, they have to really be willing to stick with this and be very consistent. If they give attention to a behavior sometimes, if my child whines, and sometimes I pay attention, sometimes I don't, it'll really, really maintain. So next slide. So what we want parents to do is to just ignore this behavior. Tell the child, I've already told you no, we're not talking about this anymore, and then ignore. But they have to expect there'll be what's called an extinction burst. If I'm used to getting attention for something and someone's ignoring me, I'm going to get louder. I'm going to get bigger, right? If that's when the parent finally says, I told you to stop, once the child really gets loud, they have just given attention to the escalation of behavior. So they have to be ready to really hang in there, stick with it, keep ignoring. Eventually it will go down. But they have to be prepared for that. Otherwise, it can be very frustrating. And we coach them on how to stay calm, how to really ignore. And then they have to circle back, by the way, and give positive attention once the behavior stops. So that's important too. Next slide. And I'll go through these pretty quickly. We also will, talk about how to, another form of punishment is to systematically remove privileges. So if you haven't got through your morning routine, then you won't get that, the TV time, or you haven't done your homework, you'll lose something. But we want parents to do this just as systematically as earning points, so that it's really based on something they've already determined with the child. If you don't follow my directions 2 times, then you lose this. You lose a marble, or you lose a toy privilege or something. That it's not, they get angry and then it's like, that's it, no Legos for a month. But that it's very specific to a very reasonable amount of time. We know that short timing of removal of privileges is much better than long. So this can also just be added to a behavior plan. And we want parents to give a warning, which is kind of a prompt. Next slide. So timeout is something that parents often will try this and they don't use very effective methods for timeout. It goes horribly wrong and they just say timeout doesn't work. But it really can work if they use it effectively and kind of start early on. So, we want to keep timeout limited to just a small number of behaviors. So only for something like hitting, or only for something like repeated noncompliance. But be really careful about starting to overuse this. And I also really distinguish timeout as a punishment from, hey, why don't you take a few minutes to go to your room and calm down a little bit and use some, cool down tools. Those are very different things. So timeout is a negative consequence. It's a punishment for a negative behavior that ahead of time they've told the child, this is what earns a timeout. So you really want to stick to just a couple of behaviors. A timeout in the room is generally not a good idea. You want it to be boring for a short period of time with a visual reminder, and not give attention, and have some plan for what to do if they either leave timeout or don't go to timeout. Then we'll extend it, or there'll be another punishment that they'll lose a privilege or something. But the parent has to stay calm. They have to be matter of fact, and they have to be willing to implement this every time the behavior happens. So if I have a timeout program for hitting, and the child gets out of timeout and then goes to hit their siblings, they go back to timeout. They come out, they do it again, you go back to timeout. It's very important they stick with it, because kids will test the system and parents have to be prepared for that. Next slide. So this is just an example of how we use this ABC model. Is in the top band there, the red is, we first think, well, what's the negative behavior? What is the behavior that is the problem? And in this example, the child is playing on the tablet instead of getting, ready for school. So we think, well, what are the antecedents that are maintaining this? And what are the consequences that are kind of made? Like what's already in place? Let's analyze the situation. Well, the problem is the child has access to the tablet whenever they want it. They haven't really listed their routine, and they have a consequence set up, which is earning stickers. The kid doesn't care about stickers. Okay, so that's what we have. We're analyzing the situation. Then we think, what's the positive opposite? What is the do behavior? We're really good at telling kids what not to do. We're not as good at being specific what they should do instead. So the positive opposite is the child independently gets through the morning routine. Okay, so what do we have to do to get some antecedents changing in the system? What are some consequences we can change? So again, we're both analyzing and then thinking, what can we do on the antecedent side and the consequence side to really support the child in being able to do that behavior? Next slide. So we of course have challenges in this type of work. You know, as I think I've mentioned a few times, of course, a lot of our parents have ADHD, so it's hard for them to be consistent. I encourage them a lot, you know, be kind to yourself. This is hard for you. You know, it's hard work, especially in families where they have more than just one child with ADHD. Also, quite frankly, you know, I mentioned child therapy is for ADHD is not really a thing. Parents, you know, a lot of times, understandably, would love to just drop their kids off and have them get therapy and change, but quite frankly, it takes parents changing parents' behavior, and that's hard. It could also really be in contrast to how they were parented, and quite frankly, that's our best model for most parents. That's their best model of how to parent is how they were parented. Right? There's their example. So if it's very different from what we're recommending, that can be a hard shift. And especially in parents where they have very different styles or they're co-parenting, even if they're not separated, it can be very difficult if they both have very strong feelings about a certain way of parenting that's in contrast to each other. And quite frankly, access to care is hard. We have a long wait lists in my clinic. There aren't that many community providers. So it's just hard to be able to connect sometimes families with these services. And ideally, this is a treatment that is for school-aged kids. Once these negative patterns have developed well into middle school and high school, it is very hard to kind of walk it back, especially in regards to screen time. That is really where, if certain patterns have developed about screen time, very, very difficult to turn that around. But that's why we really want to work with these kids when they're school age. Next slide. So here, just again, I'm hoping some key takeaways for you, you know, in primary care is really, you know, things like modeling for parents, effective instructions, labeled praise, really encouraging parents to take care of themselves, that there's not, you know, if they're overwhelmed and stressed and kind of chronically yelling, it's going to be really hard. So trying to stay calm, engage in self-care. I mean, these basic soft skills of effective instructions, catch kids being good, use praise, all of that can really be helpful, even if they're not going to do a formal behavior plan. And again, this idea of knowing, having parents kind of understand that if they start to really change things up, things might get worse before they get better, but stick with it and just kind of anticipate that, be prepared to also just stay calm. Next slide. So here are, again, in our clinic, we do both parenting groups with a combination child skills group. We also do individual work. PCIT is very effective for young kids, not just ADHD, but just behavior problems, aggression for really young kids. PCIT is fantastic. We offer that in my clinic. And also PCT.org will have a list of providers. CHAD.org has a really good remote parent-to-parent program. And then SF Parent Training Institute offers parent training in multiple languages. Alan Kasdan has an online store. And what's not listed on here, regretfully, is Clarity Pediatrics. So Clarity offers PMT. It's all remote. And they offer PMT for school-age kids. They also offer emotion dysregulation. They offer coaching on for kids to have better executive function skills. So, and they offer something called Ruby, which is parent training for kids who have both ADHD and autism. So they do medication management for the cases that they will work with, again, it's all remote. So they don't, complicated cases are not best to send to them. But for kind of pretty straightforward cases, they do quite well. They take insurance. So that's what's huge. And I think they take Medi-Cal as well. Next slide. There's one. I'm sure there's one. There isn't one. So, all right. So good. We have time for questions. I made it 10 minutes.
Thank you so much for the informative talk. And I see there's one question here. I also have some questions that I very frequently get from PCP from the consultation call. So I wanted to share those with you too. But the question from Brandy is, can you go back to the Rita, can you go back to the morning routine slide? And wanted to take pictures and maybe look at it again. It will be a great visual tool for a lot of parents.
Yeah, and I'll say, as far as the way that parents can put this together, as Rita's finding that, I always tell them the format doesn't matter so much, right? It could be a piece of paper. Some parents get very fancy. If you're really crafty, like developing a picture board and then they move the pictures, that's okay. But essentially, the main elements are really making it clear what the actual behavior is, how many times the parent will prompt them. I think it was maybe a couple more down, one or two more, maybe a third down, one more. Yeah, there, that one. I think that might be it. So, I mean, here's one we actually put together, with a family. So again, it has all the elements of what's expected. It's visual. The child has put it somewhere. They're checking it off. The one with the colors, I'm not sure if that's it. But anyway, so the actual format doesn't matter as much as these elements. How many reminders per step? What are they supposed to do? And then what's in it for them to do this? What time do they have to be done? So being very specific about these elements. And then what's the reward? Notice also that this includes an immediate reward. Oh, the one with the snake. that's more the parent-child interaction patterns, right? So that was early on in the presentation. That was really describing kind of a typical interaction pattern that's a problem. So going up, it's like maybe the fourth slide. Yeah, the one, there we go. There it was. Looks like a snake. Down a couple more. There we go. Yeah. So again, this is just what plays out. This is what we call the typical parent-child interaction pattern, where the parent starts off kind of nice, optimistic, and then progressively gets more and more yelling and begging and, prodding the child to get ready. The child only listens at the very end. So yeah, so this is this common pattern that it's kind of nice to normalize for families when they see that this is so common. But this is what we see a lot of the time.
Yeah. It's really helpful to look at the typical pattern. And I think that often really resonate with parents to just start from there for them to have more trust in PMT can work.
Yeah.
They often are very surprised to hear, how do you know my house routine? Since they're also similar.
Yeah, the parent training in multiple languages is San Francisco Parent Training Institute. And it's great. Their website will lay out, okay, here's when we have, Mandarin PMT, there's a Spanish PMT, English. So yeah, it's great. And I think it's either free or it's very low cost. So that's a great option too.
A few questions from my consultation. Can you share a little bit about how the design punishment? And I think a lot of parents are very interested in that in a beginning stage of PMT. We definitely encourage them to use positive reinforcement, building that relationship first. But I often have parents who come in and just tell me that nothing works. My teenager is not interested in any of the reinforcement. I have to take their phone away for 10 days, blocking access to tablet or TV for 1 week. And that usually just don't go well. And then the conflict continue to escalate.
Yeah, that's tough. And of course, with teenagers, like I said, like that pattern has been so ingrained and developed, it's really hard. And chances are there's so much negativity that it's really tough. But what I really encourage parents, if they're thinking about punishment, it's just a very simplest version of this. If your child isn't doing what they're supposed to be doing, what are they doing instead? Right? Are they playing with Lego? Okay, we'll restrict Legos then, right? So it's really just holding back on something that they have to do a behavior before they're able to access. So yeah, for teenagers, a lot of the time, this is like, no, you can't have Snapchat until your homework is done. But the sooner they can develop those patterns, the less likely it is they get in what we call this coercive pattern, where the teenager is just badgering and badgering the parent until they give in. So ideally, they're starting early on by staying very calm and matter of fact, like, nope, it's most helpful. Do your homework, then you get this. Nope, you can't have your phone yet. You definitely cannot go, take your phone at nighttime to bed. Anyway, so developing those patterns early on is best. But essentially, a family like that, I mean, we want them in family therapy to really get some behavioral contracts going, but also get some goodwill between the parent and child, which is much harder to do as teenagers because, for young kids, we can say, oh, we'll play games together. Well, a teenager, they just want to spend time with their friends anyway. So it's much harder to rebuild that relationship with a child that isn't as interested in spending time with you in the first place. So it's much more complicated, and usually that's where family therapy.
Yeah.
So
So
true PMT is really for younger kids.
PMT is better for pre-puberty kiddos, and then for teenagers, really combining using family therapy, we're combining it with PMT may be better.
Exactly. Right.
There's one more question, but before going into another question, we're just gonna run a brief poll. Rita, could you pull the poll? Quickly submit your answer so we can continue improving the quality of our education activities. Also for CME credit, please also make sure to use the QR code. We're gonna share that in a minute. There's a slide. I will share the QR code with you, or click and use the link that's posted in chat so that you can collect the CME credit for today. But for Dr. Zalecki, there's another question that was asking about the free San Francisco training in multiple different languages on the topic of PMT.
Oh, that's the the parent training institute in San Francisco.
Parent Training Institute in San Francisco. Gotcha. And then while we still have 2 more minutes, yes, I can see a CME slide. So you can use this QR code or the link in the chat. Another question that I got is parent, a lot of times there's only one parent who can attend PMT. And is that still helpful? Is there any recommendations that you give to?
Yeah. So that can be tough, but also we want to meet in the same way we want to meet kids where they're at, not where they should be. We want to meet parents where they're at. And sure, if only one parent can attend, we'll take it. But I really then try to help them structure, like you need to set aside a time, a structured time each week that you're reviewing the handout with your partner to go over these things, to get on the same page. So it's not all on you, because it is hard for a parent to learn the skills and then teach the skills. So that's where now that we're able to do more remote work, is really helpful, because hopefully we can at least find some time that the other parent can attend. But yeah, ideally we have both parents, but even if just one, it will take it.
Thank you so much for sharing this topic with us today, and we all learn a lot. For our webinar next time, we have 3 webinars this month because we have a 5th Thursday. So our next webinar topic will be on stress resilience for clinicians, led by Santoy Trotter, who's a director at one of the services at the Oakland site. Thank you so much for joining us today, and we look forward to seeing you in 2 weeks.